Did you know that there has been a recent cluster of eye syphilis cases? In the medical world, this has raised quite a few eyebrows. But before we dive into the specifics, let's first understand what eye syphilis is. It's a manifestation of the sexually transmitted infection syphilis, caused by the bacterium Treponema pallidum. Instead of the usual symptoms, this bacterium affects the eyes, leading to reduced vision or even blindness. Why is this important, you ask? Well, it's because eye syphilis can occur at any stage of the infection, and if left untreated, it can cause serious and irreversible damage. The recent cluster of cases has prompted concerns from the Centers for Disease Control and Prevention, signaling a potential public health issue. It's crucial to understand this condition, its causes, and how we can prevent it. Stay tuned as we delve deeper into the details of this worrying trend. To understand eye syphilis, we first need to grasp the basics of syphilis itself. Syphilis is a bacterial infection caused by the bacterium Treponema pallidum. This bacterium is sneaky because it can lie dormant in your body for years, sometimes even decades, before showing any symptoms. And when these symptoms do appear, they can be quite varied, making the disease difficult to diagnose without a specific test. The infection is typically transmitted through sexual contact, which includes vaginal, anal, and oral sex. It can also be transmitted through close skin-to-skin contact if the syphilis sores or rashes are present. It's important to note that syphilis can't be spread through casual contact, such as sharing a toilet, clothing, or cutlery. Now, syphilis isn't a picky disease. It affects both men and women, and it can also be passed from a pregnant woman to her unborn child, a condition known as congenital syphilis. This is particularly concerning as it can lead to severe complications in babies, including premature birth, low birth weight, or even stillbirth. The symptoms of syphilis are often described in stages: primary, secondary, latent, and tertiary. In the primary stage, a person may notice a single sore or multiple sores at the location where the infection was transmitted. These sores are usually firm, round, and painless. In the secondary stage, rashes might appear, and these can show up when the primary sore is healing or several weeks after the sore has healed. The rashes are usually rough, red or reddish-brown spots on the palms of the hands and bottoms of the feet. However, rashes with a different appearance may occur on other parts of the body, sometimes resembling those of other diseases. The latent and tertiary stages of syphilis present more severe symptoms, including damage to the heart, brain, and other organs of the body. Now that we understand syphilis, let's take a closer look at its ocular manifestation. Scene script. Eye syphilis is a form of the disease that affects the eyes, and it can lead to serious complications. When syphilis, an infection caused by the bacterium Treponema pallidum, invades the visual system, we refer to it as eye syphilis. It's a condition that can manifest at any stage of syphilis, but it generally arises during the secondary or tertiary stages. The symptoms of eye syphilis can be quite diverse and may include blurry vision, floaters, or even vision loss. Others may experience redness, sensitivity to light, or sudden eye pain. It's also not uncommon for individuals to experience symptoms in both eyes, although it can certainly affect just one. How do doctors diagnose eye syphilis? Well, it's a two-step process. The first step involves a blood test to detect antibodies against the syphilis bacterium. If the blood test comes back positive, the doctor will then perform a lumbar puncture, also known as a spinal tap, to confirm the diagnosis. Now, let's talk about the potential complications of untreated eye syphilis. If left untreated, this condition can lead to serious vision issues, including permanent blindness. It's also worth noting that syphilis can affect other parts of the body, including the brain, heart, and nervous system, leading to a range of other serious health problems. This is why early diagnosis and treatment are so crucial. The good news is that eye syphilis can be effectively treated with antibiotics, particularly penicillin. However, any vision loss that occurs before treatment may not be reversible, hence the importance of catching it early. The recent cluster of eye syphilis cases has prompted concern for several reasons. The rise in cases, coupled with the potential for serious complications, underscores the importance of raising awareness about this condition. It's a reminder that regular testing for sexually transmitted infections, including syphilis, is a key component of maintaining good health. So, as we delve into the details of the recent cases, remember the importance of staying informed, getting tested, and seeking treatment if you're experiencing any symptoms. Awareness and action can make all the difference. Since the start of the year, there has been a significant uptick in reported eye syphilis cases. a silent epidemic has been rearing its head in communities across the nation. In the last few months, there has been a startling rise in reported cases of eye syphilis, a manifestation of the infamous sexually transmitted infection that affects the visual system. The cases are popping up far and wide, from bustling metropolises to quiet suburban towns. The rise has not been limited to a particular demographic or location. Rather, it has been indiscriminate, affecting people regardless of age, gender, or lifestyle. It's a grim reminder of how infectious diseases can silently infiltrate our lives. The Centers for Disease Control and Prevention, or CDC, is on high alert. They've been closely monitoring the situation, tracking the spread, and investigating the factors contributing to this sudden surge. The CDC's concern is palpable. After all, it's not every day that a disease thought to be under control suddenly shows an unexpected resurgence. What's even more troubling is the severity of the cases. Many of the affected individuals are presenting with advanced stages of the disease, suggesting a possible delay in diagnosis. This has led to increased complications and, in some cases, irreversible damage to the eyes. In response to this alarming trend, the CDC has sprung into action. They've extended their surveillance network, reaching out to local health departments and physicians to stay updated on new cases. They're also ramping up their research efforts to understand why this sudden increase is occurring. In addition, the CDC is pushing for increased awareness. They're urging medical professionals to consider eye syphilis in patients presenting with visual symptoms, even if they don't have a known history of syphilis. They're also encouraging the public to get tested for sexually transmitted infections regularly, as early detection is key to preventing complications. The CDC's message is clear. The recent cluster of eye syphilis cases is a cause for concern, but it's also a call to action. It's a reminder that we need to stay vigilant, stay informed, and take proactive steps to protect our health. The CDC is now urging medical professionals and the public to be vigilant. While the recent cluster is worrying, there are effective ways to prevent and treat eye syphilis. Let's begin with prevention. As with many sexually transmitted infections, the best defense against contracting syphilis is practicing safe sex. This means using barrier methods such as condoms or dental dams during every sexual encounter. However, it's essential to remember that these methods are not 100% foolproof. Syphilis can be transmitted through any close skin-to-skin contact with an infected area, which may not always be covered by a barrier method. Another critical aspect of prevention is regular testing. Syphilis can often be asymptomatic in its early stages, which means a person could be unknowingly spreading the infection. Regular testing is crucial, especially for those who are sexually active with multiple partners. Public health organizations recommend getting tested for syphilis at least once a year, or more frequently if you're at a higher risk. Now let's move on to treatment. If a person is diagnosed with syphilis, the good news is that it is entirely treatable, especially when caught early. The most common treatment is an antibiotic, usually penicillin, administered either through an injection or a course of tablets. The duration and type of treatment will depend on the stage of the infection. But what happens if syphilis has progressed to affect the eyes? Known as ocular syphilis, this condition can cause severe vision problems and even blindness if left untreated. However, with prompt diagnosis and treatment, the progression can be halted. In some cases, eyesight can even be restored. It's also worth noting that individuals who have been treated for syphilis in the past can get the infection again. Therefore, continued safe sex practices and regular testing are vital, even after successful treatment. With awareness, prevention, and timely treatment, we can tackle this public health challenge. Let's not forget that knowledge is power. By understanding the risks and taking proactive steps to protect ourselves and others, we can make a difference in the fight against syphilis. This upswing in eye syphilis cases serves as a reminder of the importance of sexual health and regular medical checkups. It's crucial to remember the basics. Syphilis is a sexually transmitted infection that can manifest in various ways, including ocular complications. This recent cluster of cases has caught the attention of the Centers for Disease Control and Prevention, underlining the significance of the situation. Eye syphilis, though a less common manifestation, can lead to serious visual impairments if not treated promptly. Awareness of the symptoms, early detection, and appropriate treatment can prevent severe outcomes. It's also essential to understand that prevention is better than cure. Safe sex practices, regular screening, and prompt treatment of syphilis can help prevent its ocular complications. In summary, Vigilance, awareness, and proactive health practices are our best defense against eye syphilis. Let this recent spike in cases serve as a wake-up call. Remember, your health is in your hands. Stay informed, stay safe.